beginning of last season in preseason, I ended up getting a minor concussion just at the end of the preseason. It's hard to remember a little bit sometimes from the concussion, but right away you kind of feel yourself a little dizzy, you got headaches, your ears are buzzing, you know. They said, take your time off, we'll take the load for you. You can't rush into anything when you have a concussion. You got to make sure you take that extra time off. And then see from there, go through the protocols that the doctor gives you and take your time with it.
You know, I think the idea with the concussion program for kids is we want families and kids in our region to feel like they have the knowledge and the support as an athlete in the WHL would have with their medical team, and we want everybody to feel like they have that information.
It was Christmas Eve and Kyrell was downstairs playing with his brother, and all of a sudden we heard this shrieking scream, so we ran downstairs and he was holding the front of his head. His brother had said he fell forward on the carpet and hit his head without catching himself. We asked him a few questions, what day it was tomorrow, and being Christmas we thought for sure he would remember, and he didn't, so we knew something was up.
So this protocol has been created to address children who come into our emergency department with a head injury. And it's a set of tools that we'll be using as emergency physicians that will allow for a consistent evaluation of patients so that they can receive the proper diagnosis and proper treatments, and subsequently the proper follow-up.
The doctor assessed him and we were told he had a concussion. We were monitored for the 4 hours and given a sheet saying what to look for within the next 24 to 48 hours.
So I think we know with concussion that the first few days of recovery are the most important. And so in order to have that information and to have that knowledge, proper assessment is really important so that they follow through with these guidelines and recommendations.
After they're assessed by a physician and a concussion is diagnosed, forms will be sent to their school as well as to our therapies department, who will provide follow-up after they've presented to the emergency department, providing that phone call in 24 to 48 hours after the head injury.
It lasted longer than what I expected for it to last. Things like his moods changed. He wasn't as happy-go-lucky little boy as he usually was. It would have been nice to have known that recovery will take longer than a couple days. Also, that he was going to be moody. That was one thing that we weren't told, is that his moods could change.
With this program, we want everything to be consistent, and with concussion, there's been so much new information come out in the last 5 years. We wanted to make sure that the information that we're providing to families and to the school team to be consistent, and so that families feel supported in their child's recovery.